Okay. Hi, everyone. So, welcome to our MS Together webinar on managing MS. We are very excited to have you here with us this evening, and thank you very much for joining us as well on this Tuesday evening. Um, my name is Amy, and I'm the founder and CEO of MS Together, which is a charity focused on supporting young adults who are living with MS. But tonight's session is all about providing people with MS and people affected by MS with practical, supportive, and evidence-based insights to help you feel more informed and empowered in how you manage your MS. So that's whether you're newly diagnosed or have been living with MS for a while, or if you're just joining on behalf of someone living with MS as well. So we've brought together three brilliant speakers who will be sharing a mix of medical knowledge, real life experiences, and simple techniques that you can take away and try in your own time. So before we get started, just a few really quick housekeeping points. This session, as you've seen, is being recorded, and we'll share the recording with everyone who signed up after the event. The recording will also be uploaded. Oh, sorry. The recording will also be uploaded to YouTube, and the only people seen on the recording will be the people who are pinned to your screen, which is the you should be able to see all the speakers, except it's just I think it's unpinned. Sam, can you pin everyone to the screen, please? Thank you. So the all speakers, like I said, will be pinned to the screen when they're presenting. And if you have any problems during the presentation, you can reach out to myself or Sam by sending a message using the chat. Please keep yourself muted unless you're invited to unmute during the Q&A. And you're welcome to use the chat box throughout the session, whether it's to ask questions, share reflections, or just say hello to each other like you've all been doing. And you should be able to find the chat function at the bottom of your screens if you haven't already found it. If at any point you need to take a break, stretch, or go and do something else, like eat your dinner, that is absolutely fine. It's a relaxed and supportive space for you to enjoy. So a quick intro to our speakers before we get started. So first off, we will hear from Ruth Stross, who is an experienced MS nurse and head of nursing at Neurology Academy. We're also very proud to have Ruth as one of our trustees at MS Together. And today, Ruth will walk us through the basics of managing MS, covering how treatment and lifestyle changes can work together, what to consider when thinking about disease-modifying therapies, and her top tips for those who are newly diagnosed. A quick disclaimer and something to note when asking questions. While Ruth is a very experienced MS nurse, she will not be able to offer any personalised medical advice during this session. The information she shares is intended to be general and informative. So if you do have any specific questions about your treatment or care, please speak to your MS team or GP. Next, we'll be joined by Olympic athlete Lina Nielsen, who lives with MS. And we're also very lucky to have Lina as an ambassador of MS Together. And today, Lina will be sharing her personal journey and a bit around the role of movement, diet, and rest in her routine as an athlete. And finally, we'll hear from Jordan Bone, who is a chronic illness coach and well-being advocate. Jordan will be offering practical tips for managing stress and sleep, which are two very important things when it comes to MS. And she will then guide us through a short demonstration of a technique called tapping. So we'll then end the session with a Q&A. So do pop your questions, like I said, in the chat as we go. You can also use our Slido, which I'll put in the chat as well. Or you can save your questions to the end when our speakers will all be back on screen together. So thank you very much again for being here, and we really hope you find tonight's session helpful and full of lots of useful takeaways. So first off, let's get started with Ruth, and I'll pin you to the screen, Ruth.
Thanks, Amy. Thank you so much for inviting me today, and I really hope that this is a helpful session. As Amy said, we can obviously take questions at the end, so I've kind of kept this to what I feel is top line and what would be important for today. So as Amy said, my background's I've worked in MS for over 20 years, and I've worked in neurology for about 35 years. So absolutely love this area, and I'm incredibly passionate and quite excited about the changes that we've seen in the care of MS. And I'm really looking forward to the other two sessions today, which will hopefully follow quite a bit of what I will be mentioning as well. So this is what I'm going to try and cover. Just a little bit of an overview of managing MS and what it is. As Amy said, I'm going to just cover a little top line around disease-modifying therapies, how a little bit around treatment and lifestyle changes can kind of work really well together. And I think we'll obviously have a lot more on that from the other two speakers. And then tips for you, and hopefully you'll find them helpful. So first off, I just want to look a little bit around kind of how you manage MS. Now, I was thinking about this when I was putting this together, and I guess when someone first comes to see me in clinic and they've just had a diagnosis, and hopefully they're coming to see me as soon as possible after that, um, I know that you will have generally had quite a lot of information and it's quite overwhelming. And I guess I feel my role as a nurse is very much kind of listening and placing. So again, although I'm going to go through a little bit around MS now, I would tend to pitch that at what I feel would be helpful at the time. And I know that there's lots of information online. I would definitely recommend that you go through places like MS Together and the MS Society and the MS Trust, the places that you probably have heard a lot about, because unfortunately there's a lot of information that is very misrepresented and quite untrue nowadays. So to put it basically, multiple sclerosis is a long-term condition where the immune system kind of affects it attacks the brain and spinal cord. It can cause a whole wide range of potential symptoms, but it's very individual to the person experiencing them. So what happens in MS, particularly, is, as I've said, what the immune system is attacking, as you can see in this image, the axon is the nerve, is the way that messages are passed down a nerve, and there's motor and sensory, and then there's different types of nerves. So the difference between those is some messages are coming from the brain out, brain and spinal cord to your hands, your feet, etc., different parts of your body, and some are taking the messages back to your brain. So what happens is the myelin sheath, which is that cover you can see around the axon, gets demyelinated, and that affects the message passing through, and it kind of can slow or block the message. Is MS the same for everyone? Absolutely not. I'm sure you know this already from talking to each other. It's really individual. Some people have very mild symptoms, some people have completely different symptoms. One of the things that Amy and I have done a lot of education in the workplace is around invisible symptoms. So there are visible symptoms which others can see, and invisible symptoms that I know you will know a lot more than I do about this. And I think that for me has been a huge piece of education. I think that I would say generally outside in amongst family and friends and where you go to work, that is something that a lot of people don't know. So we have been doing a lot of education and trying to, I guess, trying to let people know what's happening that they may not see, so they don't, so basically don't pass judgment, and to listen. Um, there is no single cause with MS. It's a mixture of genetics, environment, and things like vitamin D, which I'm sure you've heard about, and the immune factors. I guess the main thing is it's absolutely nothing that you've done. Um, as yet, it isn't curable, but it is very much treatable. The new disease-modifying therapies, well, they're not so much new now, but they are relatively new in the big scheme, reduce relapses and do slow progression. So it's really exciting. I think everyone's path through the disease is very different. So when you have the discussion with your teams around what is right for you, I think it's their job to really listen, because it isn't a one size fits all. It's very, very individual. Um, and I think it is, I think I think that is being recognised by healthcare professionals. I don't think we always get it right by any means. And I'm sure some of you haven't, there may be different experiences within this webinar. I think the main thing for me is that if there's anything you're concerned about, please do get in touch with your team. And I hope that you build confidence in their management and in that relationship to be able to disclose anything that you feel that would be helpful. I know sometimes it's really tricky to work out whether to speak to your GP or to the MS team. I just would say ask someone, whoever you feel is important. One of the things that MS teams are really trying to build on is what we call a single point of access. So just having somewhere that you can contact that's one place. Because for me, one of the things that I've really learned, particularly with working with Amy over the last few years, is that we really need to value we need to value your time. We need to value the fact that you're in work and you're juggling family and friends and absolutely everything that's going on around you. And complicating access to the NHS, which is already complicated, isn't helpful. So, if possible, ask your service for a contact email, which we're hopefully moving towards. I've had that for the last 15 years within the service, or a phone number. The good thing about email is you can do that at 10 o'clock at night, whereas sometimes trying to get hold of someone on the phone is not so easy. If something isn't clear that you've had a conversation around the MS diagnosis or what it is, then please ask. Contact them. If you have questions after your appointment, ask. And however you're feeling about this diagnosis, it's fine. That's normal. It's okay, and that kind of process can take quite a while. So just reach out to whoever you feel is okay. You want to talk through, so the MS team, your GP practice, as I mentioned, the MS Together community. I know there's a heap of stuff that Amy is doing. You may have family and friends. I know sometimes people don't necessarily want to go in that direction, but I'm sure people are there wanting to help. And there is some online NHS support. So I guess looking at the kind of key considerations around disease-modifying therapies and going back a little bit, this wasn't there when I started in MS. We didn't have any of these treatments, and this I thought might be just helpful to have a look at. It shows you, so I started in this area in the early 90s and none of it existed. So the journey to what we have today is quite amazing. And it means that we are managing a completely different disease. So the future is completely different. And I guess I was thinking through for the talk today, and I know that you're probably having the thoughts around why should I start treatment? And again, there is no pressure to make that decision at all. It is completely your decision, and whatever you decide is absolutely right. The disease modifying therapies essentially help slow down the progression or the relapses in the MS. They help to protect the brain and the nerves. And I guess it's part of the job that they do is about protecting your future. And kind of even if what's tricky, I think, is that even if you feel okay today, this is about protecting the future. So some of the research that's coming through is the earlier that you treat it, the better you're able to stay in control. But it isn't. It's never a panic thing. It's always there's always time for you to kind of think and make these huge treatment decisions. And I think that we absolutely recognise that. I think the main thing with regards to the treatments is, please, if you don't really understand the treatment options given to you, then please ask. It's really important that it fits with your lifestyle. So there are some that are 6 monthly infusions, some that are monthly injections, and there's various different types. And some of them may not suit what you do. Some of them maybe fit better. So don't rush. Just like really take time and ask questions, and maybe reach out to this community as well. We really appreciate that a lot of people are like studying, working, traveling, and just really needing to have that kind of flexibility. I think that kind of we hope as MS multidisciplinary teams, we're really kind of trying to support you to be proactive, and it's very much around preventative management with MS now, which again, as I said, is really exciting. So yeah, just take time. These are incredible. And I think there's even more on the horizon. Amy and I've been to conferences in other countries where there's lots of things on the horizon. So yeah, just any questions, please reach out. I know some of you will be saying there's a lot more people in the MS team. Absolutely. I just felt that for this talk, this was the kind of really helpful core team to be mentioning. So as the MS nurse, I guess with nursing, we feel we're quite good as a key worker. We're a really good go-to person for questions, concerns, and any coordination. The wider MS MTT that you might meet along the way, as and when needed, are absolutely there to support you, and they're hugely experienced. What I would recommend is when you go to clinic appointments, I've said this to people for so many years, I just take any questions that you have in a notebook and get the notebook out and put it on your lap when you come into the appointment and sit down, or as you come in, just have that visible prompt for the clinician that be it the neurologist or the nurse, so they know that you have questions. And that might prompt them to say, "Oh, do you have questions?" And then say, "Yes, please," because that means they will then allocate time within however long that you have within that appointment. What is difficult is when you want to ask that at the end and you're trying to, they're trying to get ready for the next appointment, or it becomes a bit more pressured. Um, and sometimes take someone with you as well is quite helpful if you can. You can always ask permission to record. I've had that recently where people have asked if it's okay to record so they can go away and have a look, and that's absolutely fine by me. I know we're probably going to hear a lot more from Lina and Jordan around this. So this was just kind of some of the bits that I talked through. So this Venn diagram, not so much around the medication, but this Venn diagram is what I draw in clinic when I see people for the first time. I just want to explain the crossover between the symptoms and relapses and disease modified therapies, because they really do interchange. So any change in symptoms or any we don't automatically assume it's a relapse. It could be fluctuations, it could be infection, but it might make a difference to the treatment you're on. And then obviously underpinning all of that is kind of lifestyle choices and a little bit around how you manage your MS outside of the disease modifying therapy. So I tend to just talk through these things so that it kind of places it. So symptom management are things that we can give you medication that you will notice a difference, whereas disease modifying therapies, you won't notice that there is no impact on your symptoms today. This is about looking at the future. And I guess the small wins are things like just kind of learn from your body signals, rest, and things like that. And I'm going to go into it a little bit more detail on the next slide. So I know you'll probably have heard a huge amount around brain health. There's lots of people out there who are covering this area. There was really interesting work from the European Association of Neurology. They had a huge conference this year looking a lot around brain health. And I guess these were some of the things that I thought might be helpful. So, as I've already mentioned, start the treatment when you're ready. Stay active, and again, this is very much what you can do at the level that you can do it. And if you speak to certain neurophysios, Jodie Barber is someone that does quite a bit online. She offers an online yoga class. And she will say, she's a neurophysiotherapist working specifically in MS. She will say anything is better than nothing, and it's incredibly effective. This isn't about trying to do lots. It's just about doing what suits you. Again, healthy eating. There's been quite a bit of evidence that's come out in the last year or so, which is really good to see. And I think that can be quite overwhelming and quite confusing. There is some information from Overcoming MS. What I would say is that just if people are trying to tell you that you should be doing something, then and you don't feel that would be possible, it doesn't fit with your lifestyle, with young children, etc., then please just, you have to decide what is going to be beneficial with your symptoms, with how you are, with your lifestyle, with your work, hours, etc., etc. We do know that the food we eat does have an impact on kind of I guess, energy levels and general holistic health. So Other thing there's been quite a bit of work done on is sleep. I would, if you can, aim for 7 to 8 hours. I know that can fluctuate, especially if you have young children or you're studying for exams and things like that. So that's kind of just like uh, if possible, and even a few nights a week with something similar to that would be great. That can help support kind of our brain thinking and overall health. Social interaction, I don't need to say we're on this call, it's absolutely crucial. Mental exercise, though, going back a few years, it was all about Sudokus. Now it's a range of different things, so puzzles, crosswords. I try to do the word on things like that are really, really helpful. Unless you do that in your workplace and don't need any more outside. And so the things that do make a difference is, if possible, limiting or trying to give up smoking if possible, and limiting alcohol, but absolutely not giving up if that's something you enjoy. It's very much that's part of the social scene, so there is no particular advice around that. And just yeah, just really, I guess your brain always loves learning and doing things. So anything that you're doing with regards to this is incredibly helpful. Now, I've just got a couple of bits here. I mean, some of the things cross over to what we've already said, but I guess for me, it's living with MS shouldn't be at all putting your life on hold. It should mean just listening to your body, seeing what you need, and finding new ways to do things if you're finding it difficult, and just reaching out to the community and to family as and when needed, and to your MS team. So go at your own pace. Definitely notice any patterns. Rest when you need it, and just yeah, any kind of things like yoga and mindfulness and meditation, things like that are incredible. I think Dr. Agnes Straukiena does quite a bit around that. If anybody's seen her online already, build your support team. That's quite helpful, and just be flexible and look after yourself. Do keep up with checkups if possible. It's difficult if you move areas or if you're at university or kind of going into a new workplace. So just get in touch and let your team know what's happening. And most importantly, just look after yourself, be kind to yourself. And I guess that's the main, the final message is that MS is a completely different disease today. We are very proactive. It's about prevention. So yeah, keep the communication open with your teams, and for me, it'd be really helpful if if you have any tips for us as healthcare professionals, because I know, having worked with Amy for the last couple of years, I've learned heaps, and really, really important things around how it's different for young adults with MS that I have taken back to my workplace and I've shared with colleagues, and we've spoken at various conferences. So if you have time and fancy scanning this QR code, I'd be really grateful. If you could let us know any tips that you have. So I think that's it. Thank you.
Thank you, Ruth. You were bang on time there as well. In fact, I think you finished early.
Yeah, excellent.
Thank you so much. That was such a good, brief but very important run through of what's available to people. So yeah, and we've got some questions already come through for you, so we'll save those to the end. But if anyone has any other questions for Ruth, either put them in the chat or add them to Slido as well. And now I'm very pleased to introduce Lina.
Hello, thank you so much, Ruth. That was really informative and saves me from explaining some of the things that will be on my slide. So appreciate that. So I'm going to share my screen. Hi, everyone. Let's see if this works because we tried to do it before. Okie dokes. Is that okay? So hi for everyone that might not know me. I'll just quickly introduce myself. My name is Lina Nielsen. I am an Olympic athlete who lives with MS. And I often wonder what I could tell people about what it's like living with MS and, my personal experiences. So I'll just share a little bit about my journey. So sorry if you've heard it before, because I'm very active in the MS Together space. I'll just try and share like a little bit about kind of why I want to tell this part of my journey and kind of what will hopefully make sense towards the end of the presentation. So my MS journey, I was diagnosed in 2014 at 17 years of age. So that picture on the right, I am the one in the purple shorts on the right. Those are all my friends when I was 17. And that picture was taken actually a couple months after I got diagnosed. I think it was around August. I got diagnosed in March. And that's just to kind of show that athletics and sport was just one side of my life. I was just a normal teenager who just loved being with her friends, and most of my friends subsequently were in the sport that I spent a lot of my time doing. So when I got diagnosed, MS did change my perspective on life, as I'm sure it would have done for a lot of people in this call. And staying active and kind of just keeping doing what I love and seeing all my friends, that kind of helped me cope with MS. And that's kind of one of the things that I'd like to share with my sporting journey. But the main reason I bring up sport is because living like a sports person gave me the tools to manage MS. So a lot of people will often say to me, wow, so to be an Olympian, you must have so much determination and so much resilience and patience and courage and emotional strength. And I listen to this and I think this sounds really familiar to a lot of people. And everyone in this call, well, most people in this call will know exactly what it's like to live with MS, and that those words describe not only a sports person, but what it's like to live with MS. You need determination. You need that resilience to kind of bounce back from, let's say, firstly, the diagnosis, and patience to kind of hopefully manage and cope while you're, experiencing relapses and things. And so I'd just like to share a little bit about how living like a sports person can give you guys the tools to manage MS. So firstly, starting with physical well-being and MS. So I fully believe that there's a place for balance when it comes to living with MS. So the reason I bring up this picture on the right, I attended a lecture with the MS Society a couple of weeks ago. And Professor Alan Thompson, who was kind of hosting the lecture, someone had asked him, what is it about, living with MS? Is it medication that will help you the most, or is it the lifestyle that will help you the most? And he answered he answered it really well, to be fair. And I wanted to bring that up. So he said, medication is important, yes, but you can't just rely on the medication. You can't just say, oh, I'm on a medication now, and completely neglect nutrition and lifestyle. So I fully believe that both have a place in living and managing MS. And when you are ready, it took me 10 years. So I always say when you are ready to decide the medication that you're on, I definitely think it's a really big step forward. But at the same time, there are definitely so many things that you can do in terms of nutrition and lifestyle that, like Ruth Stross said, that can hopefully help manage how you live with MS. So I always look at food. So I'll start with food. I have a magic formula when it comes to food, and it's really simple. There are foods that feed inflammation and there are foods that fight inflammation. That's the only way I look at it. So a lot of people will go, what kind of foods can I eat? What kind of diet can I go on? And there's so many things that are thrown around in the world with MS, and some things can be slightly true and some things can be really, really false. One of the disclaimers I would like to say is that there is no magic diet, there is no magic protocol or cure with food. But I do fully believe that food can help put your body in a better place to recover from relapses, should you be experiencing relapses, and you can help fight some of the inflammation that's going on in your body. So I put this little chart in because there's so much happening in terms of food. So what to avoid and what to go for. Honestly, there is no sort of checklist. It's kind of, that's why I simplify it and say, look for foods that feed inflammation. So that's things like alcohol. And again, that's why living like a sports person can help you manage MS. So obviously, as an elite athlete, we tend to avoid alcohol, and we tend to avoid fast food and refined carbs. And so it's kind of almost looking at your body as though you're getting ready for a big performance, kind of before sort of any, let's say you're preparing for a marathon or you're preparing for a race or something like that, you would kind of avoid alcohol. So I look at going through or living life with MS is kind of preparing your body for a massive performance, because there is so much happening on your body when you're going through relapses. So avoiding the major things, so alcohol, processed meats and high sugar foods. And then again, so I'm drawing back to parallels being a sports person. I think the last time I did a webinar like this, I brought up the supplements that I would go for. And I bring up these two supplements at the bottom because we hear a lot about vitamin D and how it can help with living with MS. But one thing I'd like to draw your attention to is the little badge on the bottom right-hand corner, which says Inform Sport. So a lot of the time we're quite scared about what we put into our bodies. I know I am when it comes to living with MS, but again, living like a sports person, I would go for supplements that have been batch tested and shown to be what it is that it says on the tin. So this is one piece of advice that I give to a lot of people. If you are going for vitamin D supplements, which I think a lot of us would be, look for that Informed Sport badge, because then you'll know and you can trust that that is what it says on the package. So my two go-to supplements are vitamin D, obviously, because it's been widely researched in the world of MS. We've seen that low vitamin D levels can lead to a higher risk of developing MS and more disease activity. And then omega-3 is something I take both as a sports person and as someone living with MS, because omega-3 is one of those things that fights inflammation. So as a sports person, there's a lot of inflammation going on in my body anyway, from training sessions and things like that. But obviously with MS, there's also inflammation in the body. So omega-3s have been kind of shown and researched to reduce inflammation in the body. So those are my go-to supplements that I take. But there's so many others that you can go for. So I've heard about vitamin B12 as well, that can be good for nerve health and myelin health. But again, I would always look for that Informed Sport badge, because that's one thing that you can guarantee you will have what it says on the package. So that's my piece of advice there. And then also when it comes to physical well-being and living with MS, one of the things that, you know, like I say, living like a sports person can do is you can be very, very in tune with your body, but also living with MS means you're also very, very in tune with your body. So it becomes really, really, really important to listen to your body, kind of know when you're feeling that fatigue or those kind of days where you're not really feeling high energy. And those are the days where you want to adapt, and you kind of want to give yourself grace and give yourself time to kind of rest. And that's kind of how physically you can manage MS. But that brings me to my next slide, which is mental well-being. So we've got physical well-being, but we've also got, let me just skip forward, mental well-being. So there's a lot that you can take or draw from being a sports person. I look at relapses, and it sounds very simple, but this is the way I simplify it. I look at it like an injury. So a lot of the time as a sports person, you might deal with an injury, and that sets you back and slows you down and stops you from doing your normal work or your normal training. And that's the kind of time where you would give your body grace. So you'd give yourself as a person a chance to kind of say, hey, I might have pushed it a little bit too far, and consequently, I've got a bit of an injury. Now, obviously, it's not as simple with MS because it is complex and unpredictable, and it's oftentimes not to do with what you did. So I know it's a very simple way of looking at it, but it's kind of how you would cope. So I would look at it like, right, so my body is telling me you need to rest, you need to recover. And so I would tend to go for the things that make me feel good. So I love taking some gut supplements. So I've been taking, this is not an ad, by the way, taking Improve, which is a gut supplement to kind of, we know that kind of inflammation starts in the gut. So I often look at how can I give my gut the good things to hopefully recover. That glass of wine is not a way to cope, by the way. That's a way for me to feel fancy. That's actually tart cherry juice. I filled it all the way to the brim, and that is antioxidant. So that kind of helps me think about, I know that it's not as simple as going, I'm going to take this and my body will recover. But if I can tell myself that these things make me feel good and make me feel relaxed and kind of make me feel like I can rest and recover, these are things and ways that you can cope. Also, when it comes to a sports person, coping strategies, and this brings me to my next point, is your team. So my team is very, very important. And you'll often hear in Formula One, it's not, you know, just the driver that's in the car. And in athletics, it's not just the athlete that's on the track. There's a whole team around you. And I often think that you can draw parallels to a sports person by building that team around you. So these pictures are my partner, my twin sister who also has MS, and my osteopath who's now become one of my best friends. And I would see these people as my team, family, friends, medical professionals, you know, reaching out to, if you have a good relationship with your consultant or nurses, or like Ruth said, your pharmacists, building that and not being afraid to have that team around you, so that should something happen, should you go through a period where your health is not so great, or you're feeling a little bit fatigued and you can't do everything that you need to, that team has already been set up and kind of built around you, so that there's different people who have different roles. So you could get your emotional support from your friends and your partners and family members, but then also to have that medical professional who might know a little bit more than you might do, and to have kind of like leaning onto that person, I think saves you that stress. So when something goes wrong, you can kind of go, right, I've got this person in my team, I'm going to reach out and say, you know, I'm scared or I need some help. And asking for help is a strength, and it does take time to kind of build those relationships. But once you have that team around you, you often feel, I guess, wrapped in cotton wool, I guess, and you can always kind of lean back and go, right, I'm good. And so not being afraid to build a team, it's something that individual athletes, so people like F1 drivers, athletes from athletics, individual sports, we often are the ones who have to reach out and build that team. And it is quite scary sometimes to kind of go, I need you in my corner. But not being afraid to build that team, drawing parallels with the sports person, can really help you when hopefully not, but when times get rough, you have that kind of person. So my practical advice for people living with MS is, like Ruth said, any movement is good. So starting where you are, so whatever kind of ability that you have, any sort of movement is really good for not only physical health, but also mental health as well, to kind of help yourself cope. Strength and balance exercises can also help. So yoga is so accessible. There's so many different ways you can do yoga. There's chair yoga, there's slow types of yoga like yin yoga. You can do fast types of yoga if that's your thing, but things like that kind of move the blood around and kind of help you. I look at it like getting those nutrients to the places you need it most. So any movement is good for you. Definitely rest and listen to your body. So like I said, living with MS makes you so in tune with your body. So listening and knowing when actually today's not the day to push yourself. And then other days where you think you have a lot of energy, you might maybe tackle your to-do list or do things where other days you might not have had that much energy. And then mental well-being. So really managing your stress, having those things that keep you enjoying life, having your teammates around you, so building that team. These are things that you can do to kind of help manage living with MS. So my takeaway message: by adopting the habits of a sports person, so listening to your body, moving with purpose, fueling yourself well, can help you feel empowered to live with MS. So I hope that was useful. But yeah, so whenever you're in doubt, just think, I'm a sports person preparing for a massive competition. That's my presentation.
Thank you, Lina. I think that was such an interesting way of looking at it. Although I've heard you speak so many times, I don't think I've ever heard you give that advice of like looking at it like you're a sports person. And I think it's brilliant. So yeah, thank you so much. And again, I've heard you speak so many times, but I've still written down loads of tips.
Yeah.
Amazing.
My takeaway tip is make sure that your supplements, like that is like takeaway, make sure that that is what it says. Because oftentimes, oh, also I actually forgot to mention that the vitamin D that tends to be in form sport tend to be higher dose than your regular vitamin D one. So I don't know, actually, sorry guys, let me share my screen one more time, because this, where is it? Oh God, can you see that?
Yeah.
These supplements here, so it's Healthspan Elite. So where it says Healthspan, that logo, fine. Where it says Elite, those ones usually tend to be high strength. So you can see that omega-3 high strength, and then the vitamin D, I couldn't find the actual picture that I have, but they do 1,000 IUs and also 4,000 IUs. And so that's a higher strength. So a lot of the time sports supplements tend to be higher doses. So that can also help us living with MS, because we know we need a high dose of vitamin D.
Yeah, amazing. Thank you. That's such a good tip. Thank you so much.
Of course. I'm excited for the next one.
And I think we'll also have lots of questions for you, Lina. So we'll come back to those later. But now we're going to pass over to Jordan.
Hi everyone. My laptop, there we go. Hope you're all doing well and enjoying this amazing webinar. I am here today to talk to you about stress and sleep and how sleep is so important. I'll tell you a little bit about myself as well. I personally don't have MS, but I have a spinal cord injury. So when I was 15 years old, I broke my neck at the C6 level. So I'm now paralyzed from the chest down. And with that, I went through a massive life change overnight. And in that time, I had dark days. I went through depression. I went through all the things when you have a massive life change. And I did so much work on myself. I did a lot of meditation and a lot of personal development that over the years, I just was always drawn to it because I knew how much it helped me personally. And now I am a coach and I mainly work with women with chronic illnesses or disabilities and it's just really rewarding space because it just feels like a safe space. And whenever I've been on calls with other people who, maybe are coaches or just trying to help you with your well-being, it's always been from an able-bodied, healthy, like 100% healthy person. And I can feel that my confidence has gained. However, I understand that there's probably a lot of people that don't necessarily feel safe in those spaces because sometimes they'll be like, oh, jump up out of your chair and all of this. And I can sometimes just like, yeah, chair dancing, it's all good. So yeah, that's a little bit about me. I'm just gonna try and see if my screen will, it's easier if I am not on the main screen and it's kind of throwing me off a little bit. Maybe I'll do a gallery, so then that's better. So today I wanted to speak to you about a few things that have helped me and what help people that I know and my clients. And I was going to talk to you about meditation, which I probably will touch upon, but I want to share with you something that's a little bit different because we've all heard of meditation, we've all heard of mindfulness. I thought I would talk about a thing called EFT tapping. Sam, would you please share the screen? Okay. Hasn't come up for me. Oh, there we go. So Tap That Tuesday. I have a series called Tap That Tuesday, and I was like, this is brilliant. Today's Tuesday. I'll just, put that on the slide. So today I'm going to demonstrate a bit of tapping to you, which is a stress technique, like a release of stress. If we go down the slide a little bit, there's more on there. So what is, oh, sorry, Sam, can you go up one? I'm a bit, yeah. So EFT tapping, which is emotional freedom technique, was actually created a long time ago for soldiers with PTSD. And it's a mind-body therapy because you're combining like psychology and Chinese medicine. Think of it like acupuncture without the needles. So we're tapping on those like acupuncture points throughout the body, shifting an emotion, shifting a feeling that you no longer want, or you want to tap something in. So say you're feeling anxious, and with tapping, what you do, which is quite interesting, is you talk about it. You really get deep with why you feel anxious. And even if you don't know, just say all of the things, how you're feeling at that time, whilst tapping on the side of the hand. And it's really funny because you'll start with thinking, oh, I feel 10 out of 10 anxious. And then after some time of tapping, it should get down to 1, hopefully. But it reduces cortisol, it reduces stress by tapping on these points, and it can reduce stress up to 40%. So I don't know about you, but sometimes I do struggle to unwind. I struggle to bring myself back down, get in bed and go to sleep. And I think that can happen because there's pain, there's stress, and with tapping, it can kind of shift a bit of those feelings and you feel a little bit more calm. It's really important to have some water, so I'm actually going to have a sip myself now. So it reduces cortisol, and because it engages the amygdala, which is the stress center, which is really interesting. And this is a free tool. Like a lot of the time we have to do, we have to buy something to help us. And this is something we can do anywhere, anytime. And there's a sequence. So there are loads of different places that you tap. But if you are just feeling a little anxious somewhere or You could just literally sit there and just tap like this on the side of your hand. It's so interesting how it works. Can we go to the next slide, please? So I will do a demonstration with you guys in a moment. So how to do tapping. So like I just said, on a scale of 1 to 10, how much do you feel the feeling that you want to resolve? So say if it's stress about going to sleep, or just anxiety in general, or it can be about loving yourself, like you don't feel like you like yourself, or you're just anything. Like on a scale of 1 to 10, how do you feel? And then, like I said a moment ago, you'll tap on the side of the hand to talk negatively about it. And that probably seems strange because you've probably heard of like affirmations, and yeah, we will do that at one point, but we have to shift the energy. So by tapping on meridian points in the body, you are shifting the negative feeling. And by even talking about it, some people might be like, oh, you're just affirming this. But no, we are shifting that energy, because energy gets stuck. So we are shifting it, and then we put in positive affirmations afterwards. And then after some time, some little rounds of tapping, see how you're feeling about it. It's really important to tune into yourself and to actually think, okay, how am I feeling now I've done that? I personally, when I tap, feel the energy like flowing through my body. That I think this is incredible. It's like just like magic buttons. And I just love that. And I think just having extra tools in our toolbox to help us feel well rested, to help us feel more confident even, and just relax for the evening especially, is so helpful. But yeah, it's really important to tune in with your body and how you're feeling. So that's that part. I think that is literally my slides before we go into the little demonstration. So other techniques, like I've said at the start, is meditation. Meditation was the thing that I first discovered that really, really did help me. So if you haven't tried meditation, I would really recommend it. It's proven to relax mind and body. Guided meditations are great. I personally love a guided meditation because you have something to concentrate on, as opposed to really like thinking, I can't think. But meditation is not about just not thinking. It's about just becoming present. But guided meditations are always helpful. And then if you're one of these people that are like, I haven't got time for that, well, then you always have time for 60 seconds. So box breathing is really helpful, just to bring you back to your body, bring you in the present moment, and just to ease your mind. So box breathing in is you breathe in for 4, hold for 4, out for 4, hold for 4. And you do that a few times. Nighttime routines. I love my nighttime routine. It's something I really look forward to now, because this is basically mine that I put on here. It's like skincare, making your environment as relaxing as you can. So I have a salt lamp. I always have like one of those candles that flicker, because I just like the sound. And it's putting your phone down. It's like, oh, we want to hold on to those phones, but they bring so much dopamine, but then it's just not great. It's like a dopamine hit, and it's not healthy to be glued to it. So getting away from the screen an hour before you're going to sleep, especially, and you want to unwind, put that down, because that's not important right now. And mindfulness can really help in the evening as well. Like, think about what you are grateful for right now. Think about what in your life you feel just like, wow, I'm so grateful for that. And I just have no doubt about feeling grateful about it, because it then puts so many like positive thoughts into your mind, because there's so much to be grateful for. It just relaxes your mind. And I would also say, if you wanted to, is journaling before bed, or even voice noting into your phone if you don't want to write, just to get everything out of your mind before you unwind. Because I can sometimes, if I haven't, lay there and be like, I'm doing that tomorrow. Or should I do this? It's like, get it all out before you relax, because relaxing your body just helps everything. So sleep is going back to what I was saying. Sorry, I'm all over the place, chaotic. Sleep is so important. Rest is so important for just literally everything. We can achieve more and feel well more if we make sure we rest without the stress or the pressure. because I think sometimes we put pressure on ourselves when we can't sleep. So even just doing things like meditation, tapping, having a nighttime routine, and doing some mindfulness can really just bring you to the moment and help you feel better. So if you would like to do a tapping with me right now, then that would be amazing. I would like to say,
I'll stop sharing so that everyone can watch you for the demonstration, and we'll share these slides at the end if anyone wants to see any more.
Yeah. Is there a way that I can just be on the speaker again? Oh, now it's Sam. How can I see myself? Because that will help me with my tapping as well.
You should be able to pin yourself if you
Yes.
Yeah.
There we go. There we go. Feel that now. So when I tap, because of my paralysis, my hands are like this. So I might look like I'm hitting myself in the face. I'm not. But if you would like to tap along, I would recommend using this finger and this finger to tap the places. If you feel too tired to do all the spots, I'm going to show you where they are. So one's here, top of the head, start of the eyebrow, side of the eye, underneath the nose, the chin, the collarbone, your bra strap area, and your two wrists together. I used to put some perfume on. But if you get a bit tired, because it can be quite physical, I believe, and I'm always a bit like, whew, gonna work out. Just tap the side of your hand if that's easier for you. It doesn't matter as long as you're in one of those points. But obviously, it's good to do the sequence as well. Sorry, I don't want to run it over time. So I want to do a tapping today for you to help you unwind from the day. It's your time now. So what we're going to do is talk about what you do, is you repeat after me. So I will say a sentence and you will repeat it after me, but as we're tapping, keep tapping. So just copy what I do. So you can close your eyes if you want as well. I might do at some point, probably will now. I really want to unwind right now. And sometimes I can't. Or it feels that way. I get so stressed that I'm not going to be able to just relax. Am I going to sleep well tonight? Am I going to have another restless night? I feel like I just can't switch off. And that frustrates me. And there's always something that I need to do the next day that I can't always get off my mind. And even though I feel this way, I deeply and completely love and forgive myself. Okay, stop for a moment, take a deep breath in, hold it at the top, let it go. Does anyone feel like anything throughout the body? So when I tap, I then feel like I said at the start, like a vibration through my body. Like when I stop, I'm like, wow. So if you felt that, that's normal. Also, guys, if you yawn a lot in this, it's normal as well because it's the energy. So we're going to go to the top of the head and we're just going to tap and just repeat after me. It's time for me to unwind. My day is done with. And I did the best that I could. I feel like I feel like it's time to relax. My body wants to relax. And I deserve to rest. I have no more obligations for the day. So whatever I'm thinking about for tomorrow can be there tomorrow. But right now, I'm going to just let my body rest. I'm going to let my mind rest. I am going to breathe and remind myself that I am worthy of rest. I am so relaxed. I am excited to get cozy in bed, knowing that I am going to sleep incredibly tonight. Tonight is going to be the best sleep I've ever had. And I'm going to wake up tomorrow so refreshed and inspired. I am so grateful for the rest that I receive. I am so grateful that I'm taking time for myself right now. And even though I was worried that I couldn't unwind, I deeply and completely love and accept and forgive myself. I am going to rest now. I am worthy of rest. There's nowhere I have to be and there's no obligations. And that's fine. So now I am going to have the best evening of rest. And so it is. So take a deep breath in through your nose, hold it at the top, and out through the mouth. And I just want you to feel throughout your body how you're feeling. I want you to tune in. And because we are often go, 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 we forget to tune in. And doing these things really does relax us. I have an aura ring, and this ring gets me into the relaxed and restored state. The ring doesn't, tells me that I'm in the relaxed and relaxed and restored state once I do a tapping. So it's so interesting how it works, and it can work for so many things. But I thought having something to help you unwind for the evening would be perfect for today. I hope that was interesting for you. And yeah, there's so many things to say, but I'm glad that you found it relaxing. What I will suggest though, because we are moving energy, so this is actually energy that we're moving, we're shifting, we're rewiring things in terms of how we think of ourselves. It's really important that we hydrate. I love cucumber water at the moment with mint in. Hydrating yourself is so important because you're letting that energy then flow through. Sounds woo-woo, but it is a thing. So that's important, and drinking water is always great. So I hope that helps you understand tapping a little bit. I hope it did helps in some way. And yeah, thank you for having me today. I really appreciate it. And that's it.
Thank you so much, Jordan. That was so good. We've had a few comments from people that have tried the tapping along with you. So someone said they were tingling, Someone else said, I feel a bit of pins and needles in my left hand after that, but might be my overstimulation. Par, how do I say that word? Sam, help me.
Paresthesia, I don't know.
I will say though, so with tapping, like I said, you can yawn. Pins and needles are actually normal for tapping. It's yawning, pins and needles. You may get emotional. Literally at the same time, I just said you may feel emotional. And I forgot as well, I was going to pull an affirmation card. So I'll just quickly do that if that's okay.
Yeah, go for it. Thank you.
Oh, well, this is a nice one for us all. I am ready to receive the abundance of the universe. So just remember how worthy you are, that you deserve all the best things in your life and you're ready to receive. So in a way, coming on this call today, it's like, oh, you're allowing yourself to receive some information that can be really helpful in your life. So hopefully that was part of that.
Amazing. Thank you so much, Jordan. That was a really nice way to end as well. We're gonna move on to questions. We've got quite a lot of time for questions, which is good because I know we've had a lot coming through. So we will get all the speakers back, and then I'm going to hand over to Sam to facilitate the Q&A.
Yeah. Hello, everyone. So I'm going to do a bit of a mixture if you want to keep popping some questions in the Slido and in the chat. But we'll start off with some of our earlier questions that were probably aimed towards Ruth. So one of them we've got is for around the understanding of how do I know if something is just a new symptom? Is it a relapse? Is it just a flare up? Have you got any sort of rough guidance? Like you said, everyone will experience things differently, but what is a way to maybe navigate that?
Yeah, that's a really good question. So it's onset of a new or new symptom over the last 24 hours or an old symptom that you've not had for the last month. One of the things that we like to eliminate is an infection. So if you've had a recent viral illness, I'd like to think that most MS teams will routinely, at the point that you present or you get in touch with the service, will routinely test urine just to rule out infection because you can have an infection that you're not aware of. So you don't necessarily have any symptoms. And I mean, people on the call may have a lot more experience, personal experience, but from what I've been told, it is just a case of learning what is a fluctuation and what's a new symptom. And all I would say is, if you're at all worried, get in touch with your team because I've never. I would prefer you to get in touch with me and ask than worry about it at home. It could be that it's absolutely unrelated to your MS, and again, that's just a learning thing, and it's really hard to kind of give that whole answer here. But so yeah, I've had lots of people just contact me over the years and say, is this related to? But when you look at other comorbidities, maybe it isn't. Essentially, it's about treating how people are. So if it turns out that it's a fluctuation, then it is looking at whether it's infection and treating it. And then sometimes, even if it is an infection or a viral illness, it's then kind of revisiting it in a month and just seeing how am I? Am I okay? Do I need to get back in touch with the team? And just seeing if things settle. I don't know if that helps. I know if it is a relapse, so if you don't have a viral illness, if you have tested your urine and that's negative, and the symptoms persist, then it is a case of having a chat with the team as to whether you're eligible for the steroids, and then it's about looking at the disease-modifying therapy that you're on and whether that change needs to be made. So again, that should be a conversation with wherever you are. So hopefully the bit I mentioned earlier about the single point of access is in place. For me, that's key. You just need to know who you want to contact at the very beginning.
Thanks, Ruth. And then our next one is probably more aimed at Lina around people would like to know how you came to terms with your diagnosis emotionally.
Yeah, that's
a good question.
It's a good question. Do you know what? Over the years, so I've lived with MS for 11 years now. And over the years, I've seen so many different ways how people have accepted it. And one thing that used to like really I guess not so much annoy me, but made me feel like I was a problem was that people would often like say that they spoke of relief when they got diagnosed, and I could not resonate with that. I was like, what do you mean you're relieved? But what does that mean? Like, I feel like my whole life is over. So there's not like a one size fits all in terms of how to deal with a diagnosis. And I will say, like, it is going to be so different for everyone because of how you experience MS in the early days. But one thing I would say, and this kind of relates to the question that was just asked to Ruth, but I would keep a journal of kind of how MS has affected me mentally and physically, because it really just helps to kind of put things from your mind and put it down on paper, or make an electronic journal or something. And it kind of just like lets you see it in front of you. You can kind of see the journey, and just take your time. I don't think, telling someone like, I'll just be fine, you'll be fine. Like it's just not the best way for anyone to kind of come to terms with the diagnosis. But I often think if you can empower yourself, so I think journaling can help you empower yourself to kind of look at it from a different perspective. But then also when you're ready, because I know this takes people a long time, I would research MS. And I say this because it took me 10 years to like really, I'd say maybe 9 years, to really like understand what's happening in my body with MS. And don't Google it, like go for the good resources like the MS Society, MS Trust, because you can feel empowered when you learn actually what's going on in your body, and it doesn't seem so scary anymore when you kind of learn the science behind it and things like that. And then you can kind of understand what happens in your body when you have a relapse, and kind of what happens when your body tries to recover from relapse, and then also how medications can help. Because I think MS is, and I learned this at the lecture that I went to actually, MS is quite slow in terms of how quickly research gets to the medical professionals. So if you can actually do your own research on what's happening within MS research, you can kind of see that actually it's quite hopeful right now, and it's getting to a more hopeful place, the way that research is going with relapsing remitting MS and also progressive MS as well. There's so much positivity happening, and by learning that yourself, I think you can kind of see that it's not what we knew it was 10 years ago. I think the kind of main things we see with MS is quite outdated, if I'm being honest. And so if you do your own research, you can kind of see actually it's come a long way, even in like 2 years. I know that Ruth mentioned the timeline of medications that are available to us. The medication I'm on, it was only available to me 2 years ago, which I just think is crazy because I got diagnosed 11 years ago. And like that's just the way that it's going. It's like actually maybe even in 2 years' time, we're going to find something that could repair myelin. And it's just so it's really quite hopeful, and the research is really quite good. So I would say definitely do your own research, and I say that in terms of your own body, but then also what's happening within the MS space itself.
Thank you, Lina. That's really helpful. I think a lot of people will be able to relate to a lot of that with like, taking the time to then come round to doing it. We've got a couple of questions, Jordan, around tapping. So around how often should we be doing it? Is it something that can just be done when you feel like you need to do it, or is it a good habit to build into your routines?
You can literally do it as many times as you want, because you can do it about anything, about any feeling. You can do literally, and you can do it until the feeling like, so, you want to do it until the feeling kind of feels not so heavy and big anymore. So, and once you start feeling a bit more relieved, then like you can stop doing that one. So you can literally do it for 5 minutes, or you could do it for half an hour, depends how long it takes. But yeah, you can do it every single day. I personally do. I do, like, especially in the morning, because you can do a morning tap in to have like a great day ahead, and it's just helpful to rewire your brain in that way of thinking, oh, actually, because it's just basically you are putting great things in for a great day if you want to do a quick one. But if you want to do like really long ones as well, you can't do it wrong, basically. It's maybe the routine you might have to learn, but once you know that, it's pretty simple, even if I explained it probably a bit complicated. But
No, not at all. It's amazing. No, it's really good. Thank you. The demonstration definitely helped. Like when you can see somebody doing it, it does help, doesn't it?
Yeah.
Ruth, we've got a question that someone's curious to know, and I'm sure a lot of people are, around how do they know if their treatment is working for them?
Yeah, the $1 million question. So I'm going to say, what do you mean by treatment? Because that encapsulates pretty much everything we've been talking about. So there's that diagram I showed at the beginning with the Venn diagram, there's disease modifying therapies, which can be treatment, and then symptom management is also treatment. So if we're going to talk about disease modifying therapies, then that will be around the MRI scan that hopefully the team will be having, dependent on the treatment that you're on. You will, and I would ask, if you don't get given the results and if you don't discuss it in your appointment, I would ask for that information, ask what the result was, ask to see your MRI if you're happy with that. It's a really useful process, and it can kind of give you an idea of maybe what it looked like and what it looks like now. The other thing with disease modifying therapies is obviously the reduction in relapses from whatever happened in the past. The bit that's a bit more tricky is this underlying progression. I know you've probably heard it termed other words. And that can be a bit more invisible, and some of it's seen on MRI scans and some of it isn't. And it's something that I think we don't know, we are starting to learn about. So it's sometimes called that PIRA, progression independent of relapse activity. So that is something that is being researched by MS healthcare professionals at the moment. If we're talking about symptom management, then yes, you should expect to see a change in your symptoms. So if it's about mood, you're taking your, using, and I would say EFT is fantastic. I've used it personally. Or if you're on, and I would say first line should be looking at the kind of talking therapies or other ways. Everybody likes to support themselves differently. Sometimes it's going to the pub with your friends, sometimes it's talking to one person that you don't know. So definitely look into those things. And then if you're on medication and you feel these things are not working, then you need to contact the GP or the MS team. So with symptom management, we expect you to see a difference like now. So if that isn't happening, so with pain or your energy levels and things like that, something with fatigue is always make sure that you have bloods done to rule out any other reason. The amount of time that I've had people who've not come to me and said, I've been quite tired, and actually it turns out that their blood levels are low in certain areas, and so that's contributing to their fatigue. Or there's other things happening, so increase in stress. There's lots of things that can affect. So yeah, it's just about having that conversation. So I hope that helps.
Thank you. And the next one probably is one that I'll open up to everyone, probably to answer, and it's all around how to cope with, or any tips with dealing with comparison or FOMO, or feeling like you're not living, and then in air quotes they put a normal life. I'll open the floor to whoever wants to jump into that. Lina, maybe do you want to go first?
Yeah, that's a really hard one. I definitely definitely can resonate with that, because when I got diagnosed, I found it so hard not to compare myself to my identical twin sister who did not have MS and was living a normal life. And it is really, really hard. And there's, again, not like a one answer for that, but I think it's definitely a journey, and it comes with how you accept your MS, and that can take weeks, months, years, decades, I don't know. But it's something that, again, I think comes down to that personal journey. It's how you look at it. So the way I look at it now is kind of how I used to deal with MS when I was 18, 19, and it used to destroy me. Whereas now I can look at it and be like, I can openly speak about it, which I never thought was possible. And for me, that's a journey that has helped me accept my own life, living with MS and making the most of it. So yeah, it's definitely something that comes from a personal journey, and it's kind of like things that you do. So again, I would always say journaling is so good, because you can look back and how you used to react, when you first, I guess, got diagnosed, or if you're a few years in, and until kind of where you'd be in 2-3 years. I think that's always beautiful to look at, and it's definitely a personal kind of progression. So that's kind of my tip, and that's what's helped me in dealing with comparison.
Thank you. Jordan, have you got anything to add to the FOMO sort of
FOMO? No, I mean, I was pretty much going to say a similar thing. Like, the acceptance comes with time of like how your life might be different to someone else's, and thinking like, I want to do this, want to do that. But I think it's important to look at what you can do, and what experiences you will be having, and just, even there's going to be times, like, say, even before like with MS, or I can just say personally, before I had my accident, that maybe I'd have missed out on anyway. But I think it sometimes just gets heightened when we have other things to think about. Like, it's just so much more heightened. So I think it's about thinking about what you can do with your life and remembering this is your precious life. You don't need to be doing the same as everyone else. This is your own snowflake of a life. So I think that's just really important to really focus inward instead of looking outward all the time, looking at what you maybe can't do, or feelings of, like, it's okay to feel how we feel, but I think it's just good to always then go inward and be like, okay, what makes me feel good right now, and how proud of yourself that you are, because I think having gratitude for yourself is super important as well.
Thank you both. One that probably Lina and Ruth would be able to answer, and again, it is a big question, but any advice or tips or anything you'd give to someone that is very newly diagnosed and just feeling very overwhelmed with everything?
Oh, is this something that you would tell someone? So, as answering this question, am I giving you advice on what to tell someone else who's been newly diagnosed, or am I speaking to someone who's been newly diagnosed? Because I think
both.
Okay, so
both.
the first one, I often get asked, like, from people's partners and stuff, like, how can I support them when they're being newly diagnosed? And I would often say, let them kind of decide that timeline, because oftentimes you can be like, how can I help? What can I do? And they don't even know what's going on. Like, they've just been diagnosed. So I would often say, give that person kind of space to kind of accept it in their own time, but then also know that you can be there for them to lean on. And that can show up in many different ways. You can kind of make them do one of their favorite things for the day to kind of show them that you're wanting them to be okay and be happy. But then also, yeah, you can just let them know that when they're ready, you can be the shoulder to cry on, or person to vent out to and stuff. The second one, I think, if you're someone who's newly diagnosed yourself, the one piece of advice I would give is, like I said before, like, to do your own research when you're ready, and that's research within yourself, but then also, like, for me personally, like, seeing all the good research that's happening made me feel less scared and less fearful of the condition, because what you kind of see firsthand, like, I guess the first time for a lot of people when they heard about MS was like the worst thing ever in the world, and it's your whole life is over. But actually, when you really delve into the research, there's so much hope, and that can kind of take that fear away. But that only comes when you're ready to delve into it. So I'd often say, just take your time to accept this news that you've been given, but then the next step is to definitely just try and learn a little bit about what's going on in the world of MS.
Yeah, I would just absolutely reiterate what you said, Lina. What I tend to find is, if you're saying that you're already feeling overwhelmed, then don't try and take on any more information initially. Just step back and be clear to people around you. There are, on some of the websites, there is information for families, but I would say, as I think the key part that Lina has already mentioned, is everyone's timeline is different. I've had some people that need to absorb as much information as possible in a very quick amount of time, make decisions, and just get on with things. And other people where it's been weeks, months, maybe longer, and it's literally like every time we meet, it's how are you, and we just kind of have it almost like an agreement about we're going to talk about and how far we. And I think that kind of marries quite well with the decision around disease modifying therapies. I think the key part with me is what Lina was talking around, and I mentioned a bit earlier, is the lifestyle does make a difference. So put everything else to one side. Don't worry about what it is, or what you should be doing, but just look after yourself. And then when you're ready, reach out to people and decide at what level you want to hear that information. And I think for the other person, absolutely, I think my role sometimes is saying to them, just, step back a little bit and try and listen, rather than, I think we are quite naturally good at offering advice. And as a healthcare professional, I love doing that. So I really have learned to listen, but not just listen and hear. So sometimes maybe just say to them, I just need you to listen and hear what I'm telling you. I don't need you to comment. I don't need you to talk to me about anything. Or try and problem solve, because actually it isn't about that. You don't want them to problem solve. So, and just allowing you space to go at your own pace, really. And I think that's tricky with work. So I would say don't ever be pushed into any decisions around do you disclose at work or anything like that. If you're feeling like you've described, don't make any decisions. Just give yourself time.
Amazing, thank you. And we've got a question that is probably quite a good follow-up to that, which Lina, you'll be able to share hopefully your personal experience with it. Someone's asked, at what point did you feel okay speaking openly about having MS? They're worried about people's reactions making them feel worse because they're actually managing it okay and feel their life isn't over just because I have MS. And I guess it's that juggle of how people are going to react to you telling them it.
Yeah, like I definitely resonate with that. And I think, unfortunately, with MS, it's so unique and so complex. And so, like, it will mean, and I don't think there's any way that this will ever change, it will mean you having to explain what your MS looks like. So, when you are ready to kind of open up about living with MS, to kind of, I guess, take away that worry that people are going to look at you in a different way is to kind of say what you might have heard about MS is maybe different to how I'm living it. And so when you are ready to openly talk about it, it might mean that you have to also share kind of personal experiences as well to kind of say, don't put us all into one box. Like this is how I'm living with it. But to take that first step to actually even say I have MS, I think that comes from really working within yourself to accept it like deeply within yourself, so that when you do speak about it, it's something that you've thought about and can articulate quite well. And that comes from really sitting with yourself and talking to yourself about MS. And that again is a whole unique timeline to everyone. So I don't think there's any pressure, like Ruth said, to disclose it in the workplace if you don't feel like you're ready. But I think when you are, it can actually help you, I think, accept it a little bit more. And that's what I always say to people when I started speaking about about my MS. I actually accepted it even further. So I kind of would say I was about 60% accepting of it, and then when I started sharing it, I was very much like, yes, this is my MS and this is what I live with, and I actually felt really, really quite powerful with it. And so I do think it can be quite freeing, but again, it takes everyone time.
Amazing, thank you. And thanks to everyone. We've had so many questions that we're probably not going to get a chance to get to all of them, but I'm sure Amy will go through at the end some other ways that you can reach out. But I'll end on one that perhaps everyone can sort of weigh into. And someone's asked around how important or like powerful is mindset when it comes to living well, because obviously we've learned from each of you the physical techniques around like exercise, diet, medications, but what would kind of be each of yours advice for the importance of looking after your mindset as well?
I'll go.
Yeah.
For me personally, it's changed my whole life. So mindset, working on your mindset is so, so important. I feel like that saved me in so many ways, because it helps you then to look at things from another perspective. It also helps you just, again, like I said earlier, be so present in this complete present moment. And there's nothing to say negative. There's nothing negative to say about it, because I think it is just so, so helpful. And I think, we have tools that we can use, but often we can forget about them. And when we start doing them again, we're like, oh, wow, that's really shifted certain feelings or how I'm feeling in general. And I think so. I think it's so, so important.
Yeah, I would probably follow up on the same thing. I think the one thing I think about with mindset is how open you are to learning different things. So I think for a lot of people when they get diagnosed with MS, it's very closed off, brush it underneath the carpet. That's not me, like very much denial. But when you kind of have that mindset of actually, let me see how much I can do and how much I can control, you just don't know what you might learn. And you might just have different foods or better foods that might help you fight inflammation, but you wouldn't have had that opportunity if you didn't open yourself up to learning about it. So I definitely think like the mindset shifting to what you can control and what you can do to make yourself healthier, not just physically but mentally as well, can definitely be a powerful tool in living with MS.
The only things that I'd add is that if you're not quite there yet with mindset, then that's okay. I do think that there will be fluctuations, and I think for me it's about, from the people that I've looked after, it's about building that support team around you with your family and friends. Also having a routine, and kind of developing healthy habits if possible, and the socialization around things like this. And so it's having a kind of a network that is nothing to do with your MS. You can completely switch off, and that's your friends and family. And then maybe when you're ready, having a network of people that you can talk to that kind of go, oh yes, yeah, I have that, and you know, potentially have ways to help you to manage that. So I think mindset is important, but sometimes it's quite tricky. And so if there are fluctuations, then that's okay. Just be kind to yourself.
Amazing. Thank you all so much. Thank you, Sam, for facilitating that Q&A as well. And thank you all so much for joining. We've got 1 minute left, so I'm just going to wrap up. We really hope that you found tonight's session helpful. There's some really lovely comments already in the chat, so thank you for those. And just a huge thank you to our speakers, Ruth, Lina, and Jordan. We are so grateful for your time and your expertise and the honesty that you've given as well. And just to read some of the comments very quickly. So, have really enjoyed every part of this call. Thank you so much. I absolutely second this. Today has been a hard day. This call has filled me with hope. And thanks so much to all the speakers. Fabulous evening. And I can see there's more coming through now as well. As always, if there's anything else that you'd like to share, reflect on, or ask after the session, if we haven't had chance to answer your question as well, please feel free to drop us a message via email or reach out to us via social media. We'll be sending a follow-up email with the recording to tonight's session if you want to go back and watch it. Any links or resources that we think might be helpful for you as well that were shared by our speakers, and also a short feedback form, which would be really great if you could fill out, as it helps us shape future events. I have added it in the chat, but I'll send it via email as well. And just thank you so much for joining everyone on this Tuesday evening. And like I said, we really hope you found it helpful, and we hope to see you again soon. Thank you so much. And thank you again to our amazing speakers.
Thank you, everyone.
Thank you.
Thanks.
Thanks, everyone.
Bye.
Bye.
Bye. Bye.